Hi, parents. Good afternoon. Welcome. My name is Petra Deeter. Today, I wanted to just talk to you briefly about intervention therapy for parental alienation. Now, I get so many questions from parents about this, and there's a lot of confusion. And unfortunately, the biggest thing is lack of support and awareness out there. Even in the professional community, the people that's supposed to be out there to be able to provide reunification therapy. And sometime when you go to court, the judge will give you reunification therapy. And what does it mean? And Cassandra, hi, thank you. So I wanted to talk about that a little bit because it's unfortunately, when it comes to parental alienation, it's so different from other kind of problems that therapists are normally deal with. So they actually, a lot of the time, if they are not specialized in parental alienation, they don't actually know what they're looking at. And so, and I mean, if you look at, there was a question one time we posted on our Facebook page about, what's the most common conception about parental alienation, and you look at so many answers because this is something that is just, yeah, it's so misunderstood, and there's not enough awareness out there for this. So the reason why traditional therapy doesn't work with parental alienation is that the normal traditional therapy is they normally use what they would call like sympathy, empathy, support, and understanding, right? So the traditional role for the therapist is, let the client talk, and they sit there and, they nod their head and they like, oh, I hear you, and supporting you, right? But unfortunately, with the situation of alienated children is that the alienated child has been brainwashed, has been programmed to have a completely wrong, sort of upside down perception about the family dynamics. So these children have been taught and empowered to disrespect you, to be able to be rude to you. So these children have a perception that you are bad, that you're not deserving, that you are unsafe, and that kind of thing. So if you have a therapist that go out there that listen and just go, yeah, I understand, I see, right? So that will just further enforcing the alienation. So that's extremely dangerous. You don't want to have your children to go to the traditional therapy where they don't understand alienation. And when they don't understand the alienation, they will put this down as, oh, this is the children that's going through, maybe growing phase, maybe teenager year. It's normal for them to be rebellious, etc., etc. No, this is not the situation at all. It's completely different. And if you don't know what they're looking at, they're not going to be able to solve this properly. So let's talk about what is needed in the intervention therapy, because what you have is a dysfunctional family dynamics. So this is not a little bit of a problem, this is a huge problem. And what you need is intervention, not just a little steering. It's a huge part of it. And hi, Maura. Hi, Cassandra. I'm sorry. Jennifer said that we have not seen reunification therapy realistic, seem to create more roadblocks. Yeah, and that's a problem, right? When you have a therapist that doesn't understand. And what's worse is sometimes the therapist will only see the child. I mean, there's so many problems with a therapist that only see a child when they are supposed to be doing reunification therapy, because obviously, first of all, it's supposed to be reunification, meaning you need to put the child back with the alienated parent and rebuild that relationship. That's one aspect of it. The other aspect of it is that what's going on with the child is situational. And let me explain that. It's not something in the child. The child's not normally rude and cold to everybody, right? This is situational, so it's directly relating to how the child's behaving to alienated parents. It's like a particular situational thing. So the therapist will not understand until they have seen this, the functional, the dysfunctional, the dynamic of the family. So they need to look at the family together. They need to see both you and the child and see the power misalignment, how the power and the respect is being misdistributed, and how the child is completely disrespectful and completely have a wrong perception of you. So you need a therapist that believe in functional in family system. So that's one thing. You can't have a therapist that only supports seeing the child alone. So you have to advocate for yourself so that you get a therapist that will see allowing you in the therapy session. That's one thing. The other thing is you need a therapist that have enough what should I say, someone that have a little bit of courage, because they actually have to intervene. This is intervention therapy. This is not the normal therapy where they just kind of agreeing, right? So you need somebody that comfortable to be confrontational, someone that will be willing to go in and look at the dynamic and say, okay, this is wrong. And so three things. Their job is three things. Okay, one of that is the first thing is they have to be able to create doubt in the child so that the child question the perception of the targeted parents as well as the alienating parent. You need the child to start question everything, the belief that the child has been carried. You need the child to start going, is that right? Because so far the child has bought into this false narrative. The child has been brainwashed. So you need the child to go in and start questioning that. So that's one thing. Okay, so we got Jennifer, Mara. Hi, Joe said, I like what I hear. Thank you. Thank you, Joe. And Jennifer said, is reunification possible when one parent has moved out of state? We'll talk about that in a second. Yeah, so, okay, so that's first thing is the job of the therapist is make the child question the perception. The second thing is to put the child, because there's a power dynamic reversal, right? Because the alienating parents have empowered the child to let the child be able to be disrespectful and sometimes even violent toward you. So there's a power reversal there. So the job of the therapist now is put the child in place. You need to reverse that and make the child go back and have this. So it's very important to highlight, to bring out the shame and the embarrassment and the guilt and the remorse for how the child has maltreated you. Because this is so important, because nobody else have intervened to point out to the child that this is wrong. So, and the alienating parents have been telling the child it's okay to be rude and disrespectful to you. So you need a therapist that have enough power to go in there and look at and go, this is wrong. You're the child. You can't be disrespectful like that. And, bring out that shame and that embarrassment. You really need someone that is willing to go in and heighten that sense of remorse in the child. So that's the second thing. The third thing is, so you have the situation here is that the child is being used as a toy, as a tool, as a weapon by the alienating parent to harm you. So the third job in the therapist is to point out, to figure out how to get this to the child to see how selfish and how inappropriate it is that the alienating parents have been using the child as a weapon. So, bringing out to get the child to see how inappropriate and how selfish it is. So these are the three things that very critical. This is the job of the therapist. So you need someone that believes in the family system therapy. So not just looking at the child, but they need to deal with you and the child together and, looking at that dynamic. One, and then so that's one big part of it. And then the three things that the therapist has to do is, like I said, one is to challenge the perception that the child has about what the child think of you. This is a cognitive restructuring in the child, right? So you need a therapist that have to have experiences, have to understand this, and the thing is, you need to appeal to the child intelligence in order to question what the child has been been hearing, what the child has been programmed. You need to deprogram this. So that's the first thing, is to question the child perception. And it's so important to show the child how ridiculous it is, the black and white thinking, right? The splitting that is very common in children of alienation, is that the child will see you as completely bad, right? And the alienating parents as completely good. So it's as ridiculous as it is. The child doesn't see that. There's nobody that is completely ambivalent, ambivalent about the way they look at things, right? So you need a therapist that be able to point out that this is not normal for the child to not seeing anything good in you and not seeing anything bad in the alienating parent. So you need some, and then also for therapist to remind the child that you're not a monster if you have seen to have made mistake. It's actually human to make mistake. So you need a therapist that is able to go in and do that. So that's the second part. And like I mentioned, the third part is the second part is to bring out this guilt and the shame and the embarrassment that the child has somehow disrespect you. You need that. And then you need someone that really bring out how inappropriate and selfish it is. So a lot of parents, and I see the comment there where someone said about how difficult it is to find a therapist. And I agree, because unfortunately, as widespread as it is, and it's crazy, you guys, this is such a widespread, like it's so prevalent, this problem. I mean, sometimes people don't know the name, but if you talk about what's going on and you describe it, a lot of the time they go, oh yeah, I seen it, it happened to me, it happened. I mean, even just for me, like I all the time, people that know me from before in other area, like in other field that I work in, and now they start to see what I'm working on. They start to come forward and they go, oh, this is what happened to me, or this is what happened to my son, and this is what happened to my cousin. Like it's so common. People have seen this. They may not have a name for it. So it's very common, and yet unfortunately, there's not enough recognition. So even in the professional level, there's not enough people that know how to deal with this. So I totally understand when you say that you have trouble getting therapists. But let's talk about how can you find a good therapist. First of all, if someone approach you, and I've seen this a lot, is that because you're participating in this community that we are creating here, like with our Facebook group and with this session, is that people will sometimes notice your name, and then people will cold call you. They may private message you, or they things like that. And so that should be a red flag, because someone that is really truly good at doing this, they will not have to cold call you. They will not have to approach you and try to sell their service. So if you see someone going out there and try to brag about how they are professional in this and they can help you, you should run away. You should turn around and walk the other way, because there's not enough professional in this. And if they are really good in this, they don't have to approach you. And so the best way for you to find a therapist is find someone that have worked with a therapist that have been successfully. So, it has to be through referral. So you have to find someone that, have gone through this and they work with their child and it's been successful. And unfortunately, like I said, there's not a lot of successful case. So you need to do that. And then the other way is also to look around yourself, look at the list of the therapists in your area, and then questioning them. And it's not just like, oh, hey, do you know about parental alienation? Because when you ask something like that, people are going to say, yeah, I do. Right? Yes, I'm very good at that. I mean, that's not how you ask it. You have to ask the right kind of questions, like bring out the scenario and see what they say about it. This is a situation, what do you think? And then if it comes from them, that they themselves offering the understanding of parental alienation, this is how you find the right people. It's not coming from people that are soliciting you, like Jane said in the chat room right now. And yes, exactly, Jane. Like if you get the wrong therapist, this can do a lot more harm than good, because there are therapists that will fall for the narrative of the alienators and then will listen to that and then play into that, which is a lot worse than just, just the normal situation that you're already in. Like now you have another person that further enforcing the alienation, and you don't want to be in that situation. So yeah, so this is very important. The other thing is also, if you have a good lawyer that have worked in this field, then they might know someone that they can refer you to. So really, it has to come from referral. And if you don't have referral, then look at the list of the people, and then you have to be willing to ask the tough questions. You have to interview them, because this is too important to just kind of go by what they say. You have to really question them. This is so what you need is someone that experienced in family system therapy, and someone that really understand, sometimes it's called by different name. Some people that call it cross-generational coalition, because there's a cross-generational, like the child is aligning with the alienating parents, so that's called cross-generation coalition. People that might call it resist refusal. There's different things, but really you need someone that understand that kind of things. Ideally you need someone that actually just understanding it as parental alienation. So anyway, I just want to come in and highlight that. Now, we did a number of amazing interviews. So if you haven't seen that, like with Dr. Stephen Miller, who talked a lot about this, we also did a couple of interviews with Dr. Stanley Klewa, who we also talk about reunification therapy in that. So really check out those interviews, because that has a lot more information, and these people have thousands of cases of clinical experience. So and if you guys needed information to reach out to, and then also sometimes I get people will contact me and say, hey, could you give me contact, like recommendation for therapists, or recommendation for lawyers? It's very difficult for us to do that, because we really can't recommend anyone in particular. So the best way is to really look at the people that we interview, because the people that we have interviewed, we have done vesting on them. So if you look at the people, really anyone that we have interviewed, we believed in them. And I would say that's the first place. And if you have trouble contacting any of them, let us know, because we're happy to introduce you to those people that we have interviewed. And thank you, Catherine. She said that your interviews are such high caliber. Really appreciate that. Thank you. And we're going to have a lot more interviews coming up. So yes, so we can't really just recommend people, like I said, but feel free to contact the people that we interviewed. What was the other things that I was going to say? I forgot now. But anyway, so good luck and have a great weekend. We're going to have another, I'm going to come back in a few days, because I wanted to talk about the early signs and early indicators of parental alienation and what you should do about it. The situation is that a lot of us, as a lot of alienated parents, by the time that they realize that they have been alienated, it's kind of too late. They, because a lot of the time we don't know what we're looking at. So by the time, it's too late, and they look at, and even then a lot of parents go, they think that's something, either you kind of ignore it, or you don't know what to do with it. And then so by the time it's too late, they feel like they're completely alone, and they don't know that this is such a common phenomenon. So I wanted to bring more awareness into what are some of the early signs and some early indicators, as well as some of the triggers that could make things a lot worse, because this could be an escalating spiral that just escalating downward, and it can get really bad really fast. So if we can have early way of dealing with this. So yeah, on Wednesday we're going to come back. So if you're not already a part of our mailing list, please join our mailing list on our website at VictimToHero.com. And yeah, please like this this video, please share this. Thank you so much for your support. We are on Patreon. If you wanted to support us on there, just look for Victim to Hero. We also have Venmo, which is also Victim to Hero. So if you wanted to support us, Calvino said, in cases where parental alienation is very severe, what happens if reunification therapeutic counseling is not sought? Will the kid, when they become adults, still be alienated? Okay, so this is one of the misconception, is that a lot of people think that when the children become adults, they will just kind of wake up and realize, and then they will come back. Unfortunately, it's not always the case. So sometimes the alienation, like you said, is so severe, and the brainwashing, the programming has been so ingrained in the child way of thinking. And you imagine, right? If you go back in time, there have been, you know, generations of human that believe that the earth is flat, right? And it doesn't matter how old you are, if that's what you were told, that's what you grow up with, you don't change your way of thinking. So just because a child grow up, there's no promise, and I hate saying that, but there are certain conditions and triggers where the child will wake up, but it's very specific. And we've done research on this. We're going to publish this, so I won't talk about a lot of this, but we're going to get this through peer review publication first, and then we'll share a lot more of that. But there are very specific conditions in which the child will wake up. So just if you just have the child that grow up, it's not enough. There has to be certain way, and there's things that you can do to help with those triggering to make the child wake up. And then there's also, that's not enough. Okay, so you have a trigger that wake up the child, and the child start to question, like, was I being alienated? Was that abuse? Was that something wrong? And then it take from that point, still there's a process from that point to the point where the child will reach out to you and want to have the first contact. Okay, so that process, there's also a number of conditions, and we're also doing research on that. So but there's a lot of things that the parents can do to help with all of that. And then when you get to that first meeting, there are things that are going on in that first meeting. It has to go a certain way for the child to then continue with you, for you to have that process of rebuilding that relationship. And if that first meeting doesn't go well, the child could just go away, even though the child might realize that he or she has been brainwashed. It's not enough for the child to just come back, and it's not enough for you to just have, you know, happily ever after. So there's a lot of this. As an alienated parent, you have to get educated about it. But when you just boil down to it, there's a few things. One is obviously self-education, but as far as you and the child, you need to communicate your openness, to that you are always there, you're always going to be available for your child, that you love your child, that you are safe. So, you know, loving, safe, and available, those are the three things. You can't be dumping your emotional baggage on the child, because your role, as always, is a parent. And if you want to rebuild that relationship, you can't rebuild it by putting the blame and shame on the child. You have to make the child feel that you are safe and that you are open, and imagine the suffering that the child has gone through. So you can't put the shame and the blame on the child. So as always, despite everything that may have happened, that how rude the child has been and how the child has rejected you, you could be hurt and you could be very offended and everything, you know, but you can't put any of that on the child. You have to get your support and your help from somewhere else. You need to get your healing somewhere else. You need to be whole and loving. So get that somewhere else. Build your support system, you know, like finding people that understand it, people that have gone through this. So, you know, like our Facebook group, for example, get therapists so that you can get a safe, emotional safe place for you to dump your emotional baggage, right? But your child is not the dumping ground. So definitely be that safe place for your child to come back. So, you know, despite all this, you know, there's a lot of dynamics that we're doing research in, but the key at the end of it is you as a parent have to be open, have to be safe, have to be available, and always showing your love. And so there's a lot more to this. And we have an interview with Dr. Fabricius coming up. Check out on our events that are coming up. So he did a lot of research into parent-child relationship, and he looked at a emotional security model. emotional security model is to look at, how strongly the child and you have that emotional bond, right? So he has a study, and we're going to dig a lot deeper in the interview, but I just wanted to kind of highlight two things in his model. Like the two key variables in this model is that for the child to have secure emotional security with you, there are two things. One is direct interaction, right? So you think about how people say, a picture is worth 1,000 words, right? But really, activity is worth 1,000,000 pictures, right? So really, if you can have direct interaction with the child and not just sitting there talking, not just sitting there watching TV, it's not just the child in the house and you on the phone and the child is on the TV. No, direct interaction. So, if you have any time with a child, create activities, because that's how you create direct interaction, quality direct interaction. So that's one variable, is direct interaction. I know a lot of parents lose their parenting time, so they don't get contact. So the second variable in the emotional security model is responsiveness. So this is to do with when the child expressing their sadness or their happiness or anything, right? So the responsiveness is how you respond to that. Because sometimes, when the child says something, and especially if you have been mistreated, sometimes alienated parents will react to the child. That they may be cold or rude or maybe screaming at the child. How dare you say this? Things like that, right? So you don't want to do that, because the responsiveness, how you respond to the child, play into the emotional security between you and the child. So despite everything that's going on, you need to choose your battle and you need to figure out how to do this properly. And also the responsiveness doesn't have to be in person. It could be by text messages, it could be through social media, things like that, through phone call, FaceTime. So I just wanted to bring out those two things, like I mentioned in this emotional security model. One is direct bonding, and the other one is responsiveness. And remember that responsiveness is through the perception of the child, right? So you could say to someone, "Oh, I love you," and that person might just listen to that and go, "Yeah, I hate that. I hate hearing that," right? Or you could say to someone and say, "I love you," and that person may love it, right? So it's about their perception of how you do it. And so when it comes to your child, you need to learn how your child perceives things, right? You need to be aware of that. And like, for example, one of the tools is called the love language. We've been trying to interview the author of the love language. There's a book out there called The Love Language. He wrote a few books. Some called the love language for teenagers, and some are love language for children and things like that. But that's one aspect of it, is how do you respond so that it's being perceived the way you intended to, right? You wanted to show that you are supportive, that you are loving, and you want them to see it that way, instead of you being supportive and they look at it as you being cold or rude. So there's a lot into this. The other aspect of it is therapeutic parenting. I also want to do a session soon that talk about that, because there's this principle of therapeutic parenting that's also very important, because your child has been injured. Your child has been through trauma. So the way that the child perceives your relationship is not a normal child. So even things that may be very normal could be seen completely different. So you need to approach the child with your toolkit. You need to have this emotional package where you know how to deal with this. It's big and it's difficult. I know, you guys, and I'm sorry, of what you are dealing with is a lot. But it's something that you can't give up on, because this is your children. So anyway, enjoy the rest of your weekend, and we're gonna talk again soon. Thank you so much. Bye.